Hi everybody. Today we're going to talk about the heart murmur, which worries a lot of people, but sometimes is what we call an innocent murmur. It can also be a significant problem. It just depends upon what the murmur sounds like. Now, a heart murmur is basically something that's heard with a stethoscope. So stethoscope is the thing that the doctor puts on your chest to listen to your heart. A doctor with real good ears, so to speak, and real good knowledge of a heart murmur will pick up a heart murmur that's there. Sometimes doctors don't have a lot of training in, picking up heart murmurs, and they may miss it. I have for years tried to put stethoscopes on patients occasionally when I've already known the pathology, or already known the heart problem. And there are certain things I can pick up with my ears and know that that's the problem, like a ventricular septal defect or maybe aortic stenosis, which are can be significant heart problems. But for a lot of the other things, I'm lost. I have no idea. So to try to explain the heart murmur, I'm going to add a few little pictures, and we'll see if you can get the gist of it. Okay, so I found this picture. It's called the heart murmur pathology. Pathology is basically what causes the problem. So it's, whatever is causing the heart murmur. So sometimes heart valves fail to close or open properly, causing turbulent blood flow or blood through the blood vessels. And then turbulent blood flow causes high and low pitch sounds known as heart murmurs. Heart problems caused by the malfunction of heart valves. Now, a heart murmur is not always caused by the malfunction of a heart valve. You can have what's called an innocent murmur. Some patients have murmurs when they have fevers, because the heart rate is always higher when you have a fever, because your body is trying to eliminate what's causing the fever, usually a virus, sometimes bacteria, depending upon what it is. So your heart rate goes up, and then you get what's called a systolic ejection murmur, which is the heart's pushing blood through the outlet of the aorta and the aortic valve, and because it's going through so fast at a high rate, it'll produce a murmur. Unfortunately, because of the way medicine is today, a lot of doctors will order an echocardiogram to evaluate the heart murmur, and they're basically kind of what we call covering their ass, because they heard the murmur, they made note of it. If they don't get an echocardiogram done and there is a significant problem, guess who gets sued? So anyhow, that's one of the problems with having a heart murmur. So this is a picture of a heart cut in what we call a long axis view, which is a view that we use in echocardiograms, and it can give you the chambers here. So this section above here is the right ventricle. This is the septum that separates the two ventricles. And this whole area here is the left ventricle. This is the mitral valve right here. And this is the aortic valve. So we can see two of the four valves pretty well in this view, and gives us a good shot. This is the left atrium, by the way. This is the ascending aorta, which goes down to the descending aorta, which feeds the whole body with blood, remember? So we'll show you one of the things that can cause a murmur. So one of the things, like I said, that can cause a murmur is if, let's say the aortic valve starts to get thickened So the valve leaflets get thickened and they don't open very well. And the blood can only go through this little opening here out to the aorta. Now that will cause a very high-pitched murmur that if you're listening, let's say this is the baseline of your stethoscope, and this is what we call systole, so where the QRS, the EKG, goes like this, and then goes, to the T wave, which we explained in one of the other ones. What this will do is cause a very high-pitched murmur in the beginning of systole, and then when diastole starts, you usually don't hear a murmur, so it'll just go flat. It's just the sound that's picked up if you were to listen to it with an electronic device. That's kind of what it looks like. And that murmur itself is a sign that there's something significantly wrong. This is the kind of murmur that you would usually hear in the elderly. Every once in a while we get surprised and it'll be in someone who's younger. That's usually when they're born. Everybody's born with 3 leaflets of the aortic valve. And this is what they look like. So each one of these opens. You have well, it's not important what cusps they are, but there's left, right, and what's called the non-coronary cusp. And each one of these opens to let blood out of the heart. Now, occasionally, let me see if I can get rid of this. Yep. Sorry about that. But anyhow, occasionally, people are born, if you were looking right into the aortic valve, instead of the 3 cusps that I just explained, they'll be born with 2 cusps. Sometimes one on top, sometimes one on the bottom. Sometimes it can go like this, and there'll be one on top and one on the bottom. It just depends upon each person. Everybody has a little different type of cusp, and that cusp itself will open, but as time goes on, that cusp itself will narrow and become very thickened, and it will not open very well. And that will cause a heart murmur, which will, hopefully send the patient to get an echocardiogram after they see the doctor, and we look at the valve, and if it's stenotic, unfortunately, if it's bad enough, we're going to have to replace this valve, the aortic valve. Usually in a younger person they put a mechanical valve in, so because they last longer. If it's an elderly person, then they put in a pig valve or a bovine or cow valve, which they can do, and that'll take care of the murmur and also take care of the problem, which is even better. So anytime you see someone with a heart murmur, or hear someone with a heart murmur, like let's say a friend tells you, yeah, the doctor says I have a heart murmur, but I'm not going to worry about it. Well, if the doctor tells you you should get a test for the heart murmur, go get the test. All right, don't play games, just go get the test. This is especially true in children. Children themselves can have a variety of problems that will cause a heart murmur. They can have a small hole, let's say right here, that allows blood to go into the right ventricle from the left ventricle. So from the LV to the RV, right ventricle, left ventricle, and that will make a lot of noise. So if a doctor puts the stethoscope down, especially a good pediatrician or a good neonatologist puts the stethoscope down and hears a harsh really strong, really loud murmur, they will probably assume that there's a ventricular septal defect. That's what that's called. So there's a small hole between the two chambers. Now, we can see this on echo, and then if the hole is right around here or down here, those murmurs usually, or those ventricular septal defects usually will close by themselves. If it's up here, same thing, but if it's way up here, sometimes they don't close on their own because that's not as muscular as it shows here. It's more of a fibrotic membranous kind of, or just, it looks more like this tissue up here on the aorta. So it doesn't have the ability to close as well as these areas do in the sense of this part of the heart. So a lot of times if they have a sizable, like let's say it's this big, ventricular septal defect, that can cause an insufficient jet or a jet of leakage into the left ventricle because this leaflet here is weak. So they have to have that fixed, because if they don't get it fixed, then the aortic valve is going to go bad. So usually once they fix it, that makes this more strong and the leak goes away. So in kind of a layman's terms, that's how it is. I went a little further into this than I probably should have, but I just wanted you to know that there are several things that can cause a heart murmur. It's very important to get your heart murmur checked out. Even if your doctor says, I think it's an innocent murmur, it's probably a good idea to ask your doctor to go get an echocardiogram to see what it is. If the echocardiogram is normal, then the murmur is an innocent murmur. So, in the sense of a heart murmur, I would always go get it checked out and make sure that it's just an innocent murmur. If it's just an innocent murmur, you've got nothing to worry about. But if we find something, then we can monitor it and make sure that the problem is not something that will cause you to have, sudden heart failure or anything of that nature. They may have you come in and have an echo once a year just to see how it's doing, and that's okay. It's not that big of a deal. Just come in and do it and, get it over with. And if the doctor says everything looks good, there's no leakage of the valve, there's no stenosis of the valve, it's probably an innocent murmur. If the doctor says it's an innocent murmur, then what I would do as a mother or a father of a child, and as a adult too, is get a copy of the report that says, that you have a normal heart, and bring that and put it in your filing cabinet. Because if you get a physical for a new job, let's say, and the doctor hears this heart murmur, you can hand them that piece of paper and they'll know right away that the heart murmur is not a problem. For kids, when they get school physicals, a lot of times the doctor will hear a murmur. If they hear a murmur and you have that report showing that they have a normal heart, then they won't worry about it. They'll just, approve the kid to play football or whatever. And but heart murmur sounds scary, but really, in most cases, in adults that are young, it's probably nothing, but it's always good to have it checked out. And the elderly, it's another story. Usually a heart murmur is a valve problem. In kids, it can be anything, unfortunately. Kids can be born with a lot of different problems, so very important to get it checked out. So that's this lesson. I hope you enjoyed it, and we'll talk to you later.